ICML, we're presenting preliminary results for a phase 2 trial that combines Rituximab and Epcoritamab for patients with follicular lymphoma. So Epcoritamab is a CD3/CD20 bispecific antibody that's approved for relapsed or refractory follicular lymphoma, where it's associated with high complete metabolic response rates and durable remissions. And based on those encouraging results, there are a number of trials that are moving bispecific antibodies like Epcoritamab into earlier lines of therapy, including in the front line. So in our trial, patients receive 4 weekly doses of Epcoritamab before the first full dose of, 4 weekly doses of Rituximab before the first dose of Epcoritamab. And the goal of the Rituximab in this study is twofold. One, to improve the depth of response, and second, to debulk patients before they receive the first full dose of Epcoritamab with the goal of improving cytokine release syndrome. So the plan for this trial is to enroll 35 patients. As of the data cutoff back in January, 31 patients had been enrolled. They had fairly high-risk features. About a quarter of them had bulky disease or grade 3A follicular lymphoma. 97% had advanced stage disease, and over half had a high FLIPI score. And among the response evaluable patients, the best overall response rate was 100%, and the best complete response rate was 92%. Very high numbers for this disease. And with about 6 months of follow-up, no patients had relapsed. So obviously we need longer follow-up, but those preliminary results are very encouraging. And we saw a manageable safety profile. CRS was the most common adverse event in about half of patients, but we saw very few cases of higher grade CRS. There were 2 cases, or 6% of patients with grade 2 CRS, and no grade 3 or higher CRS. So I think our hypothesis that pretreatment with Rituximab can lower the risk of high-grade CRS seems to be true. So we're excited for longer follow-up for this trial to see how durable these responses are. And based on the encouraging results so far, the trial has been expanded from 35 patients to 100 patients, and enrollment continues.